I'm going to be showing you how to apply the DynaCleft Nasal Elevation System. To start with, these are the supplies that you'll need. You'll need a package of DynaCleft Nasal Elevators, which comes with most of the supplies, a piece of Duoderm, extra thin, which will be in contact with the skin, and a small pair of scissors. I'll be using this model patient. When you open the DynaCleft Nasal Elevation System, you're going to find a package of actual nasal elevators. Inside the package, you'll find a template. And this template is what you're going to use to measure the length of your nasal elevator adhesive. To start with, you'll take a piece of Duoderm and cut the Duoderm so that the piece of Duoderm is just larger than the foot plate of the DynaCleft adhesive pad. So I'm going to cut it. I'm going to cut it like this. And then I'm going to trim it to size to make it a similar shape to that adhesive pad. Now, if you have a very small baby, you'll probably want to cut this to be exactly the same size as the adhesive pad because it will take up much of the central portion of your baby's forehead. Now, to apply the Duoderm, you'll lift it off, and then you're just going to apply it right to the central portion of the forehead, like this. And you want to keep it below the hairline, but above the eyebrows. Once the Duoderm is applied, you can use your hand to gently mold it in place. I try to do this for about 30 seconds because that will help the Duoderm to warm and contour to the skin of the forehead. Now, once the Duoderm is well affixed, we'll measure the length of our nasal elevation system. Inside the peel pack, you'll find this small hook. What we're going to do is feed the template through the hook. I'm going to go the opposite way to measure. There we go. And so you place the hook inside the nose and then gently lift up. You want to lift the nose so that the length will be appropriate. I'm going to shorten this a little bit more. And I'm going to place it in and lift it up. Now you can see that when the adhesive pad reaches the Duoderm, it's lifting up on the nose quite a bit. So I'm going to mark that right here as our template. So this is our template, and we're going to cut the adhesive to fit. So I'm going to make a fold in the adhesive in the same place as in the template. I'm going to trim off some of the excess. And then we're going to place our hook. Now, it's important to remember that the hook needs to be in the nose, so the hook needs to fit in the same direction as the adhesive. So we're going to place the hook facing the same direction as the sticky part. I'm going to fold that down to the fold and then put the hook in place just like that. And I'm going to peel that off and then set the length. So here you can see the hook is facing the adhesive. The hook is in the appropriate length, and now we're going to peel this off. Now I'm going to start by placing the hook right under the nostril rim. You can see right there. I start kind of mid-nostril initially in the first week or two, and then I start to migrate the hook closer to the center of the nose. In that first week or two, the hook is going to pull straight up, and then over time, the hook is going to start pulling across the forehead. For starters, we're going to apply it centrally to the middle portion of the nose, and this is what you'll find. Now, when you apply the hook, you need to check to make sure it's not too loose or too tight. What you'll look for is whitening of the skin around the hook. That's common when you first apply the hook, but that should go away within 30 seconds to a minute. If the whitening or pale color to the skin doesn't go away quickly, that means the hook is too tight and it should be loosened, which is fairly easy to do by simply taking it off of the duoderm and scooting it down a couple of millimeters. The other thing you want to make sure is that the hook isn't too loose. I'm going to adjust it as an example of that. When the hook is too loose, it won't be helpful for molding the cartilage, and it's easy for the baby to knock it out. So if you find that your baby is knocking the hook out too much, you probably have the hook on too loose. Here's an example. The hook is not lifting the nose, so it's basically not doing anything, and a baby just rubbing the nose can easily knock that out of place. That tells you that the hook is too loose. Now, the other thing that I'm going to show you is that this adhesive is a little bit stretchy, and so what you'll often find over the course of a few days is that it stretches out a little bit. So when you first apply it, it does need to be a little bit tight, or you could pre-stretch it so that it fits appropriately. Now, just to recap, for the first week or two, the hook is going to go in the central part of the nostril, lifting that flattened or curved area up. You're going to lift up and apply to the duoderm, making sure that the pale color doesn't last for more than 30 seconds to a minute. You'll change the hook and adhesive typically every 5 to 7 days. And as you change the hook and adhesive, you'll move this piece of duoderm slightly over each time so that it becomes above the eyebrow on the non-cleft side. And so this is what it would look like at the end of treatment. So the pad is above the opposite eyebrow from the cleft. The hook is applied closer to the center of the nose, and it lifts the nose towards the middle of the face. And so each time you'll move it over slightly more and more to first shape the flattened cartilage and then lift the nose up into a more central position. Now, if you're doing this in conjunction with a Latham device, which is common here at Boston Children's Hospital, you'll find that as the cleft alveolar segments, or the gums, come closer together, naturally you'll want to start moving the nose into a more midline position because the Latham device will bring those two parts into a position where that becomes very easy. Now, troubleshooting. Sometimes we find that the hook is falling off too much. Again, that often means that it's not tight enough. Other times we might find that the hook starts to cause a notch, so that after you've replaced the hook, you might find a little notch forms in the nostril. When that happens, it tells you that the hook is always in the same position, and as a parent or the person applying it, you can slightly change the position of the hook each time you apply it so that it continues to round out the cartilage without forming a notch. If you ever see a scrape or abrasion to the nose, that might tell you that the hook is too tight, in which case you'd want to give it a few days break to let the skin heal, contact your healthcare provider, and then reapply it slightly more loose. I hope this has been a helpful video on how to apply the DynaCleft Nasal Elevation System. The DynaCleft is really effective. I use it often in my practice for children who have asymmetrical noses. It's wonderful because it can be started at the time of the first visit, and so we can really take advantage of the natural malleability of cartilage in infancy. Thank you.